Well, to go into this healthcare scam a bit further, okay? First of all, Obama was elected on a platform to push through a major healthcare reform in this country. So there was talk of a nationalized healthcare, there was talk of a public option, and so on, all of which by this point have been dropped completely. Now, I know that some people in this country were worried that we were going to have socialized medicine. That actually wasn't the premise, but never mind. You know, things have been so propagandized in this country to where people are fearful of some sort of nationalized program which actually would take into account private insurers. What we have now, what we have before us now, is political kabuki theater at its best and finest, because all of our politicians, essentially, with only very few exceptions, are major benefactors of the big corporations, big insurance companies, and big pharma. So this is, yes, it is a huge sellout. So those protesting against Obama's communist healthcare system coming about shouldn't be too worried at this point, because it is probably one of the largest giveaways to private corporations, just as the big bailouts to Wall Street were. So this is my standpoint, and you know, you can research it on your own, whatever. What we have here is, you know, this constant talk by the still convinced people that this bill should be passed. The reason why this bill should be passed, according to this administration, is because they promised to pass a bill. That's the only reason. That's not a good enough reason for me. Because if you pass bad bills, and if it makes things worse in the future, then it shouldn't be passed. And it's all about elections in the future, you see. It's about posturing. And it's about a fake oppositional stance between the two parties, which are essentially corporate all the way, both of them. And the American people have no voice in this. And yes, I do agree, actually, with Howard Dean when he says that this is not reform, that it is a joke and that is a farce. It is a farce because it not only cements the status quo that we have now, and it's not going to help people, it's going to basically make things worse than what they already are, because it gives all power through mandates and even further deregulation to private insurance companies, which are not covering the stuff that needs to be covered at this point. And their administrative costs are sky high, and their CEO pay is sky high. Okay, so without further polemics, you know, let me just explain you some things that you may not have been aware of up to this point. You know, right now, help is being defined as help in the form of this bill is being defined as giving insufficient subsidies to Americans who will now be forced, thanks to this bill, if it passes, to buy extremely expensive, poorly regulated junk insurance without banning actual annual limits and an extremely high out-of-pocket cost expense for those insured. And this goes for all of us, not just the people who are going to be on these skimpy plans. The insurance regulations, so they're called, are completely meaningless. You know, it is always said that, well, when you have a pre-existing condition, now you're going to be covered. The insurance cannot deny you coverage. There is nothing in this bill that prevents the private insurance industry from raising your premiums so sky high that you simply cannot afford it. So this is precisely the situation that we have now. The harm this bill will do, thanks to the excise tax, and this may be something new to you, this is an excise tax on employer-provided insurance, is absolutely mind-boggling. The healthcare bill is designed with the goal of making millions of middle-class Americans' health insurance coverage worse. This is not a bug, it's a feature. The excise tax is meant to force your employer to cut back your insurance benefits, to reduce your coverage, to increase your co-pays and deductibles. Because of that tax, the employer is going to shift that expense onto you. So what's going to happen? You're going to opt for a lower tier plan. So your coverage gets less than what it is now, or lesser, and even lesser in coming years. Once this legislation becomes fully activated in 2016, and this of course is after the next election, okay, then people perhaps will realize what has actually gone on and happened to them. Of course, by that time it'll be too late. And I'm not pulling this out of my head. This is coming, these figures are coming from the non-partisan Congressional Budget Office, not some partisan think tank of any kind. Some progressive people are finally waking up to the point, or to the fact, I should say, that they have been completely railroaded in these negotiations through concession after concession after concession to big industry. And the teabaggers, the protesters, have been equally deluded into thinking that Obama's healthcare plan was going to be some socialized medicine. No, it isn't that at all. Actually, it's the exact opposite. So it's going to make our situation much worse. And this is why this bill needs to be killed, needs to be defeated. I don't care whether you're Republican, Democrat, Independent. You need to call your representatives, and you need to tell them that if they vote for this bill, they're not going to receive your vote again. Good night.